First, establish your predicted measurement. This is calculated by sex and height in children and by sex, age and height in adults.
Make sure that the mouthpiece is attached to the body of the meter and that the cursor is on 0. The patient should be standing straight. Inhale deeply, being sure to completely fill the lungs. Place the mouthpiece into the mouth between the teeth. This is important as the blow must come from the lungs and must not be influenced by the cheeks, as happens when the lips are pursed. And close the lips securely around it. Make sure the peak flow meter is parallel to the floor. Blow out as hard as possible using as much force as possible. Patients are encouraged not to bend forward while blowing. It is important that there is as little delay as possible between filling the lungs and blowing out. Repeat the test 3 times, returning the cursor to 0 between each blow. Use the best of the 3 blows as your reading.
If this result is less than what is predicted for that patient, it's an indication that obstruction is present. If the patient has reached their predicted value or exceeded it, this is an indication that obstruction of the larger airways is not present. It's important to remember that the peak flow only reflects the lung function at that precise moment, and that other considerations, including the history, have to be considered when determining whether the diagnosis is asthma and whether it is controlled or not.